sorry about that. We had some technical difficulties, so this is going to be part 2. We're going to start with cognition. I'm going to say 3 words, and I'm just going to have you repeat them, okay?
Okay.
So, yellow house key.
Yellow house key.
Very good. What is your name?
Jaden
Last name?
Harris.
Thank you. What day of the week is it?
Sunday.
Very good. And how old are you?
19.
Very good. The next thing we're going to do is we're going to check your cranial nerves. So I'm going to have you close your eyes. I'm going to wave this in front of your nose. Just tell me what you smell.
Alcohol.
Very good. That is alcohol. Very good. And that's cranial nerve 1, the olfactory nerve. The next thing I'm going to do, let's see. I'm going to pretend this is a pen light. We're going to check cranial nerve 2, which is the optic nerve. So we're going to, actually, I can check it without it. So we're going to check your peripheral vision. So just let me know when you can no longer see my fingers.
Can't.
Okay, very good. How about now?
Can't.
Very good. And how about now?
Can't.
Okay, very good. The next thing we're going to do is we're going to check cranial nerves 3, 4, and 6. So that's going to be oculomotor, trochlear, and abducens. And so what I want you to do is just look straight ahead, and I want you to follow my finger with just your eyes, okay? So we're looking for things like even gaze and movement. We're looking to make sure there's no strabismus present. Very good. And now we're going to check accommodation. So I'm going to have you just follow my finger, and we're going to go towards your nose. Very good. And that looks great. I'm going to pretend this is a pen light. So you're just going to look straight ahead at me. Pen light in. We're checking to make sure the pupils are reactive. And everything looks good there. So reactive pupils. We're then going to check cranial nerve 5, which is the trigeminal nerve. And so we're going to check the kind of the mastication area. So right here in the jaw. And clench your jaw for me. Very good. All right. And I'm going to check in the temples. Clench again. Very good. All right. I'm going to put my hand here. I'm going to have you move to the, there you go. Very good. I'm going to have you do the same thing on this side. Very good. I'm going to go ahead and check cranial nerve 7, which is the facial nerve. And have you close your eyes really tight for me. Tight, tight, tight. Is that tightest? Very good. I'm going to have you open your eyes. Raise your eyebrows like you're surprised. Very good. Smile nice and big for me. Very good. Puff out your cheeks. Very good. You can relax. The next thing I'm going to do is I'm going to check cranial nerve number 8, which is the acoustic nerve. So I'm going to have you cover your right ear for me. Let's cover it. And I'm going to come over here and I'm going to whisper a couple of words. I want you to repeat them for me.
Dog, cat.
Very good. We're going to switch. You're going to cover this ear. We're going to repeat with 2 additional words.
Carrot, apple.
Okay, very good. I'm going to be using my tongue depressor. We're going to be checking cranial nerve 9, which is the glossal pharyngeal nerve. So I'm going to have you open. I'm going to just place this down. Say ah. Very good. I'm going to, oh, very good. She's gagging. Her gag reflex is great. So the next thing we're going to do is we are going to check cranial nerve 10, which is the vagus nerve. And because she's talking, go ahead and swallow. And she's able to swallow well. We're going to say that that's good and intact. The next one we're going to check is the spinal nerve. So I'm going to have you move your head side to side. Very good. Up and down. Very good. And then we're going to check the hypoglossal nerve, which is cranial nerve 12. So I'm going to have you stick your tongue out. Move from right to left. Very good. Let me stick it out. Very good. And up to the perfect. That's good. And then the next thing we're going to do is we're going to look at your reflexes. So we're going to start down here. I'm going to use my stethoscope as my hammer. So we're going to start with the brachial radialis reflex. Very good. And I did feel the movement there. We're going to come up here and check the biceps Very good. Felt that. And then we're going to check triceps. So I'm going to have you just relax your arm for me. Just relax. Very good. We're going to come over here. We're going to do the same thing. So again, brachial radialis, biceps, and then triceps. Very good. The next thing we're going to do is we're going to check go ahead and sit all the way back for me. No. There we go. We're going to check right here, the patellar reflex. There we go. Very good. And then we're going to go ahead and check, I'm sorry. We're going to go ahead and check the Achilles reflex. Just relax for me. Relax. Very good. Very good. Okay, and we're going to go ahead and check a reflex called the Babinski reflex. So I'm going to take the opposite end of my tongue depressor, and this is actually should not be present in adults. It is normal to be present in children or infants. Infants. Very good. So you see how she just retracts? That's what we're looking for. If her toes splayed out, that is not a normal sign in an adult, but it is in an infant. Very good. Okay. Sorry about that. Now we're going to do sensations. So I'm going to have you close your eyes. I want you to tell me when you feel something sharp and when you feel something soft, okay?
Okay.
So,
Soft.
very good.
Soft.
Very good.
Hard. Hard. Soft. Hard. Soft. Soft. Hard. Hard.
Okay. Very good. The next thing we're going to do is we're going to do something called a finger to nose test. So I'm going to have you take your finger, pointer finger, maybe touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Very good. And we're going to do something called the pronator drift. I'm going to have you close your eyes, and actually, if you can open them really quick, I'm going to have you just hold your hands up in the supination position, close your eyes for me. You're just going to count 1, 2, 3. I can count for you. 4, 5, 6, 7, 8, 9, 10.